I am a triple negative breast cancer patient. It is locally advanced, so I understand it cannot be removed by surgery. My doctor is planning for treatment with Tecentriq. What are issues that I need to discuss with my doctor, and what are the serious side effects? This is from Melissa.
Melissa, you're squeezing the juice out of my brain. All of you are. So, Tecentriq, interesting choice. It's difficult for me to understand what's your oncologist coming from, because as far as I know, Tecentriq approval for breast cancer was withdrawn by Roche Genentech. That's the company that makes Tecentriq, and they voluntarily withdrew it from breast cancer patients in August of this year. So I'm curious to see why the choice of Tecentriq. The other thing is Tecentriq, when it was approved, and it was only approved sometime between 2019 and 2021, when it was approved, it was only in stage 4 triple negative breast cancer and not in locally advanced. So the difference is locally advanced, inoperable, still hoping to get to surgery, and we treat with the intention to make the cancer operable and get the patient to surgery. So that's called the neoadjuvant chemotherapy. Doing treatments before surgery is called neoadjuvant chemotherapy. And that patient has the intention to be cured, and we get them to surgery eventually. Versus stage 4, when it has metastasized, not just locally advanced, it has metastasized outside of the breast. And in that situation, the goals of treatment is really to, prevent symptoms, extend life, and help the patient live as long as possible. In that situation, that's where Tecentriq was approved when it was approved in stage 4 metastatic patients and not in the locally advanced. But sometimes doctors would use it even in the locally advanced. I am intrigued by the choice of Tecentriq, and even when it was used, it wasn't used as a single agent. It was used in combination with a chemotherapy called Ibrance. So even then, from my understanding, the approval was withdrawn. Now, that being said, there is other immunotherapy is approved to be used in the neoadjuvant. Remember, neoadjuvant is locally advanced, not metastatic disease, intention for surgery. And in that situation, immunotherapy in combination with chemotherapy is a standard treatment now. We're happy to see it approved. It increased how many women made it to surgery and had no cancer found at the time of surgery, or how many women had significant shrinkage at the time of surgery. So immunotherapy plus chemo, but the immunotherapy drug in that situation is not really Tecentriq. A different immunotherapy is approved in that setting to get the women to get surgery and then eventually continue in some treatment after surgery. If it is stage 4 disease and metastatic setting, also immunotherapy could be an option, but Tecentriq would not be my first choice if I would be treating this person. There's a lot of details that are missing information, yeah. So it'd be interesting, and I would encourage Melissa to communicate directly with her physician, and if she needs any extra help, please communicate with me privately on the Onco Power platform.
Yeah, absolutely. We can certainly.
A lot going on. Yeah.
Yeah, definitely.